Well, I'll call this meeting to order. We'll start with the consent agenda. All the following items which concern reports and items of a routine nature normally approved at AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all these items. Consent agenda consists of the discussion, consideration, and action on the following items. Minutes of the special trustee meeting October 27th, 2020. Minutes of the special finance meeting October 27th, 2020. Minutes of the special finance meeting November 10th, 2020. Minutes of the regular finance meeting November 17th, 2020. And a check report October 9th, 2020 through November 8th, 2020.
And here he comes with the Dr.
He just wanted to get on camera, and he had given her a
Redeemed himself right in front of everybody.
I will entertain a motion.
I move we approve the consent agenda items A through E as presented.
Second.
We have a motion by Dr. Brown, a second by Dr. Hannaford to approve the consent agenda as it was presented. Roll call vote, please.
Jasper,
Yes.
Hannaford,
Yes.
Brown,
Yes.
Hall,
Yes.
Yes, that's everybody. Okay, next is CEO's report. Candace.
All right, just a few quick things. We have currently in the hospital 8, technically 9 patients. We've got 6 COVID patients that we're taking care of. And I can't express enough that encouraging people in our community to wear their masks, wash their hands, social distance, and not participate in large gatherings. We've got to respect that, and we've got to bring these numbers down. It's real, guys. We are holding a patient in the ER right now that needs to go to a higher level of care. We've had him for over 24 hours, and we can't find a bed to send him to. That's, what you're reading and hearing on the news, it's right here, and we've got to wear a mask and do all the things we know that help bring the numbers down. So please encourage those around you to do the same. Our staff's tired, it gets old, and you can imagine just sitting here. I know you don't like to wear your mask, and I appreciate you doing that, but when you're trying to start IVs and deal with things, and your glasses are fogging up, and you've got a plastic paper gown on, and all that stuff to do what they have to do, that gets tiring. It gets old. So we've been trying to do some things to keep the morale up and to recognize all of our staff because it's not just nursing staff that it affects. It affects everybody. So we're trying to feed them and give them pats on the back and let them know that we recognize what they're going through and we really appreciate them. That being said, we have moved a registration person to the lab area in an attempt to kind of separate our healthy from our sick patients. So this, more or less, the sick patients walk through the front door and register there for urgent care. Those people that are just needing labs and x-rays, they go to the lab door and they get registered there. So that seems to be working okay. It's not ideal, I understand that, but that's really a better option than walking the front door like we did the first time. So it seems to be going okay. As you can see, we did get in our Ultraviolet UVC cleaning system, and Chris, you want to tell us a little bit about that?
Yeah, so we just got this in just a couple days ago. And so basically what this does is it can go into any room in the hospital, and it puts out an ultraviolet light that will kill any mold, bacteria, anything that's sitting out there, whether it's on the furniture, the walls, in the air. You put it into each room and set it in there. It's got an iPad that has every room in the hospital programmed into it. So whenever you put it into the room, you say what room on the iPad that you're setting it in, and then you close the door. There's about 4 sensors that you set in the room, kind of in the corners and the spots where maybe it'll have the hardest time getting to. And basically those sensors are talking back to the iPad saying this is how much ultraviolet light has hit that sensor. When it gets to, I think, 46,000 units, then it's complete. And so what you can do is you'll set it up if a couple sensors go off, say they're closer to the unit, then you can open up the door, move the unit closer to the other sensors so that it gets the entire area. But it basically gives you an all-around view of the room and making sure it just cleans everything inside the room. It's set so that if anything, it has motion sensors on it, so that if anybody opens a door or does anything, it automatically shuts off. The ultraviolet light's obviously not good, especially this powerful of a light isn't good to be around. So you just be standing right up against it and looking at it. Also plants, you gotta take all plants out to kill the plants. But it's been a pretty nice thing. They put it in a few rooms and have worked on it about yesterday and today. I think they're starting to get the hang of it a little bit, but it's a pretty cool, something that we can use in every single room. So the minute somebody comes into a room and they have COVID, especially inpatients up there, the minute they're out, you can wheel this in, put the sensors around it. It takes roughly, I think they said the average is about 10 to 15 minutes for it to completely clean a room. So you can just set it in there, you put a sign on the door, and they can continue with their other cleaning. Check the iPad, it says it's done, they come back, take it out, put it in another room, and just kind of just work your way around the hospital, cleaning out the room so that you know when you bring somebody back into one of those rooms, you know it's for sure clean, but not only the wiping everything down, but this kind of goes in and kills everything else just to make sure.
Very good. And speaking of air, we do have several units that we were able to deploy to urgent care and ER. We can take them to the floor if we need to as well. They are about this tall and about that big around, and it cleans the air in the room continuously, is exchanging that and killing any virus or bacteria in the air. So
yeah, we've got about six or eight of those, so they're kind of spaced in urgent care, ER. So.
Yeah. So anyway, that's that. Carrie did get, I can't remember if I told you last time, we did get the RHC certification, but it has not been recognized by CMS just yet. So we're waiting to hear from CMS before we can move any further on that. Steve Madrid is now seeing patients in Dr. Galbraith's clinic and has now had his third freedom visit, I believe. So that seems to be going well. That's all I have. Do you guys have any questions for me?
There are no questions. I will entertain a motion.
Make a motion to approve and accept the Shared Medical Center written report for November 24, 2020.
Second.
I have a motion by Dr. Hannaford, a second by Dr. Brown, for the approval of the Shared Medical Center written report for November 24th, 2020. Roll call vote, please.
Hannaford,
Yes.
Brown,
Yes.
Paul,
Yes.
Casper.
Yes. Candace, thank you. Next is the CFO's report.
Hey, I'm going to start off by just letting everybody know these are September's financials. We've been kind of running behind with the cost reports for the nursing home and the cost reports for the hospital. So we've been kind of behind on getting financials done. The good news there is we finished up both cost reports for the nursing home and hospital. Both should be getting a reimbursement back from Medicare. And now that those are finished up, they finished up a couple weeks ago. So now that those are finished up, we're hoping that we can really get back into the swing of things and get caught back up so that hopefully the next board meeting will at least be a little bit closer to caught up, if not hopefully all the way caught up. So just bear in mind that the numbers you're looking at right here are back from September. A lot has changed since then, especially regarding COVID. So when you look at this, I'll talk about a few things that will be changing in the upcoming months that you have a better idea of what you'll see on the next reports. You can see that the gross revenue was up, and if you compare that to the prior months, you can see that we've that slowly been getting better and better. Kind of had a little bit of a dip in August, but it's kind of been steadying out a little bit at the total operating revenue is $853,383. So we're hoping that's something that we'll see continuing up. Obviously, whenever we get into October, November, that could start to vary a little bit just because of all the mandates going around for COVID. The expenses for the month were $112,000 increase from the prior month. That you will see in the upcoming months. You'll see that the expenses for the September, October, November will be higher than they have been, and who knows, maybe ever will be. A lot of that, though, has to do with our COVID dollars. So you'll see $112 more in expenses, but that doesn't mean that that is actual expenses that we are spending and not getting back. A lot of this money is money that we are spending, just like this unit. If you spend $70,000, we're going to get a lot of that back with our COVID funds that we've had. So don't let the expenses kind of throw you just because there is a lot of this money that we will be getting back. The salaries and wages, the same thing will be happening as well. Because you can see there's a little bit of an increase in salary and wages in September. That'll kind of continue to look that way as well over the next coming months. So if you look back through, you see the revenue was up $853 to $383. Part of that also had to do with COVID funds, with that the other operating revenue being at $242,000. Some of that had to do with COVID funds as well. All in all, in September, everything was looking pretty good. We still had a lot of COVID money. We had dipped into it a ton, but everything was still looking pretty good. A couple pages back, you can look at the income statement and kind of give you a little more of a cleaner overview of looking at inpatient revenue and outpatient revenue and how it had gone up from month to month, but compared to last September, it was down just a little bit. If you want to look back a few more pages, you can look at the convalescent home. Their gross patient revenue held steady. It was a little bit lower than August, but it's kind of right around where we thought it would be. Same with their total operating revenue, down just a little bit. Their expenses as well, you can see that they had roughly a $23,000 hike in their expenses. That's going to continue to happen as well with their COVID funds that we have. We're going to be spending more of their money on some of the systems that they've put into place at the nursing home. So, try not to get too caught up in the operating expenses, just knowing that a lot of that will be coming back, cycling back through the hospital and the nursing home.
Do we have to use more agency?
No, it's actually, well, I can't remember September. Well, yeah. September, no, not too bad. It was a little over $5,000. October was $6,600, and November was $4,277. So we're still not using very much agency.
Yeah, which is good. Hopefully we want to stay around there and keep it pretty consistent with what he's been doing. So.
But probably any of that agency right now is probably COVID related though.
Yeah, it's a COVID expense every month.
Yeah, you'll see it there. Hospital, same way. We've been having to do it with some of the medical staffing that we've had, kind of the same deal. So,
Will we be waiting, kind of like we did last year, for the influx of that COVID money at the end of the fiscal year? Or will you be trying to?
We have a
Some
lot, we have a lot of COVID funds already built up that we really had not used, and it's been sitting there since April, May, whenever it first came in. Really, nothing has been used as far as COVID funds. So there's a lot of money still out there that we've just now really started using. So everything we're spending right now is money that we immediately can get put right back into the account. So you're not really seeing a dip. It'll go out and come right back in.
The one thing I do want to say is that the fact that the agency staff hasn't increased for the nursing home is a testament to the employees at the nursing home and how thankful we are for them and the job that they're doing.
Yeah, trying to keep nurses right now anywhere is very, very hard. So, you know,
Trying to
Candace,
get an agency nurse is nearly
Yeah.
impossible, or it is impossible.
yeah, they're giving, like we talked about, I think Integris, $25,000 bonuses just to sign on. So there's a lot of competition right now to get nurses. So we are doing, and Candace is working hard to do everything we can to make sure we keep all the nurses that we have. Even if you need to pay them a little bit more and get it back as COVID money, you're still going to be saving money doing that than having to go out and get agency nurses.
Have you heard about, have they talked more about allowing nurses in the senior year for, after their clinical work, to be able to do some, what I think they're gonna call it maybe some internship to where they can get paid a little bit
Really?
above their hours, I guess. I think that's something they're talking about.
Good. I did hear on TV the other day the plea for those that have retired to consider coming back.
Yeah.
We do have an emergency order that allows us to do that with aides. And maybe they haven't tested yet, but as long as they've been trained and show some competencies, we can put aides to work without them having their certification.
I'll do a little check on that too.
Okay.
So as far as the financials go, I mean, like I said, this is back in September. Everything was still holding pretty steady, looking pretty good. The next couple months will be interesting to look at how the financials pan out. But that just kind of gives you an idea of what to look forward to and what to expect, so that you can see what happened in September, and then I'm telling you what to expect moving forward, so you have an idea of where we're actually at right now. I don't know if anybody has any other questions about.
Cost report wise,
Yeah, cost report we finished up, and we'll be getting that. Should be getting that. We had a reimbursement from Medicare. We should be getting that within the next. They've said in the next 10 business days, so we're hoping we should be getting that any time.
6 months?
Yeah.
I'd say February-ish. I mean, that's usually when we get it.
Oh, does it really take that long? Okay.
Oh, yeah.
So the 10 to 15 business days, she told me probably isn't gonna.
That's 6 months.
Yeah.
I
At
used to,
some point, we will be getting the reimbursement from our cost report, just in time to start ramping up for an interim cost report, so. If nobody has any questions about anything else with the statements, I think Steve was going to kind of give a run through of all the COVID funds and where it's all at.
Yeah, with your permission, I'd like to review the stimulus funding we've received and how we're using those funds. I think it'll be of interest to you.
Steve, I don't know what we'd do without you.
Well, thank you.
I definitely know. I see the amount of time he spends on doing this, and he'll do it, and then they'll come out and change the guidelines, so they'll go back and redo it, and then they'll change them back, and so by the time you get through 1 month, he's probably gone in and done it about 3 or 4 times, which has got to be the most frustrating thing. But I know that if there's no way I'd be able to sit here and try to do both this and that. There's no way.
These 2 handouts that I just gave you for the hospital, the top one up at the top left corner says as of 10/31/20. So let me kind of tell you the layout here, because there's a lot of numbers and columns and stuff. Left-hand side, it's divided into sections. The first section is the source of the stimulus money we've received. Next section is the lost revenue we're reporting, and that's the difference between the month this year and the corresponding month from 2019. So if there's a figure for a month, that means our revenue, net patient revenue was down that much this year. If there's zeros, that's an indication we actually had more gross or net patient revenue this year than last. We're probably getting ready to go the other way again because we're starting to lose some services that we provide and we're not able to provide going forward for a while. So we may see some lost revenue again. Next section is COVID-related expenses, and it's broken down by the week. So these are expenses we've had in each of those weeks related to COVID that we're reimbursing ourselves out of stimulus funds. Next section is capital expenditures. So these are capital assets we're buying that are COVID related. And then over on the second page, the bottom line there, that's the amount of stimulus funds that are remaining to be expended as of October 31st. So going back to the front page, you have sets of columns. The first set is the total for all the sources of funding, and then the next three sets are broken down. The first set being Health and Human Services CARES Act funding. Next one, Oklahoma State University Office of Rural Health gave us money. And then the third set of columns is the Oklahoma Hospital Association grants that they give us. So I don't want to delve into numbers. There's too many numbers here. I don't want to overwhelm you, but you're more than welcome to look this over. I think probably the next handout will be maybe of more interest to you because it's more current. This is as of November 30th. Same layout. I want to tell you that in November we got another $207,000 from Health and Human Services CARES Act funding. And we got another $11,600 from the Oklahoma Hospital Association. So if you look on the handout in that far right column, the one that says Oklahoma Hospital Association grant, we've received a total of $17,543.83 from them. And looking on the second page, we've used all of that money. There's no money remaining from those grants, and that money has been accounted for through them. So we should be done with them unless they decide to give us more money at some point. The columns to the left of that, the Oklahoma State University Office of Rural Health, they've given us about $78,000. As of the end of November, we've used $68,000 of that and accounted for that to them. So we have funds remaining with them. And then the columns to the left of that, of course, are the big numbers, Health and Human Services, just like on the other sheet. The amount we've received, our uses of that, and we have about $2.5 million left. So as of the end of November, we have roughly $2,567,000 that we can yet expend for COVID-related expenses. Do you have any questions about any of that? I want to give you another handout. This one is the nursing home. I don't have information yet for November that I was able to compile by today, but we can look at October and talk about a couple of things in November. Similar layout. Here we're looking at I've got two sets of columns for Health and Human Services because they have two different types of funds. They have general funds that are somewhat more, less restrictive as to how they can be used, and then they have restricted funding in that second set. But what I want you to take from all this is that we've received through the end of October over $500,000 from Health and Human Services and the Oklahoma State Department of Health. We've managed to spend about $415,000 of that, so we had about $97,000 left at the end of November, which was concerning to me because, I mean, everybody's been watching nursing homes having more and more issues dealing with COVID. Health and Human Services has realized that. Already in November, they've gotten us an additional $55,000, and today we received almost $52,000 just for the nursing home. So that figure's gone up considerably. We're up around $200,000 now that we have that we can use at the nursing home. And I wouldn't be at all surprised to see more money coming because obviously nursing homes, while they don't have a lot of the expenses that hospitals have, it's a very intense situation that everyone's struggling with. So they're going to have to throw a lot of money at it to get this thing under control. And hopefully they'll do that. So far I've been pretty impressed with the government, other than a lack of direction from them. But in a way that's good because sometimes less is better. Because you can kind of, use that money how you see fit, how it works best for your facility, and you're not under such tight restraints from the government. So I hope it remains that way. It kind of started to go the other way. They started to give direction, and it wasn't working because they were telling us one thing up front, and then 6 or 7 months later we get a different story on how we can use funds. But they've backed off on most of that. We're kind of back to where we started. So things seem to be working pretty well in that regard. I went over that very quickly. Are there any questions I can answer on any of that, or anything else related to stimulus funding, or how we're spending funds, what we're spending them on?
Not really a finance question here, because when we try to order things that we need, we have any problems getting it in?
Yeah, time-wise, it's taking a little longer than it should, but I've been very impressed with how cooperative everybody is, because they realize the mess the whole world is in. And I think everybody's really stepping up and trying to make all of this work. I'll give you an example. We had ordered 2 of those units, and then the government said we were going to be limited in how much cost we could recover. So we backed off on one of them. That company was very willing to do that. They didn't have to. It was in writing. They didn't have to, but they did. And they're giving us all of our money back.
Oh, yeah, we already cut the
Except for
check.
what we paid for. Yeah, and we'd already given them the money because we're trying to shove money through.
And then CMS changed the rules again.
Yeah, right.
So my experiences, I don't know, other people may have had.
Other supplies, we are having trouble
But
getting.
yeah, we're having some supply shortage,
Medication
the
shortages.
PPE stuff has been really hard to come by. I think that's getting,
It's better than it was the first time.
yeah.
Yeah, I think there's been a couple instances where somebody's driven to Enid or something
Yeah,
that
we've had
day.
to
and
go
try
to
pick
other
something up.
hospitals. Hospitals, we've been pretty good about sharing drugs, because you can't just order a whole bunch of medication and have it sit in there because you're going to get through it. You get like just doses, to get you to the next shipment. And sometimes we're having to share with other hospitals, I'll give you this if you give me this. We'll trade stuff out. So it's working. but thank you, Steve, I know that's a lot.
That's all I have.
I don't know.
Unless anyone has any.
Any other questions? If not, thank you guys. Next is Medical Staff Executive Committee.
So,
Well, while she's looking, I'll just say, I'm not gonna hand all this out, but this is the documentation for what we just looked at. Just to give you an idea, you know, typical government deal. They want lots of paper, and man, we're cranking out the paper.
Wow.
And that's just on the hospital, that's not the nursing home.
So we're using code expenses to restock our paper supplies. So
Yeah.
Steve gets to use all.
Part of the Paper Reduction Act.
Yeah.
all right, so med staff met on November the 18th. We reviewed and a motion was made to approve the addition of convalescent plasma to the current blood plasma policy. There are, I think, 4 credentialing committee items that we need to address. One is their reappointment to courtesy staff of Dr. Barry Rockler, MD.
Okay, go ahead.
I move that we reappoint the courtesy staff for Rockwood MD.
Second.
We have a motion by Dr. Brown, a second by Dr. Hannaford to reappoint the courtesy staff Barry Rockler, MD. Roll call vote, please.
Brown,
Yes.
Paul,
Yes.
Jasper,
Yes.
Hannaford.
Yes.
Next item is the reappointment to allied staff Marissa Endersby, CRNA.
Make a motion to reappoint the allied staff to the CRNA.
Second.
There's a motion by Dr. Brown, a second by Dr. Hannaford to reappoint the allied staff Marissa Endersby, CRNA. Roll call vote, please.
Paul,
Yes.
Jasper,
Yes.
Hannaford,
Yes.
Brown.
Yes.
Next is reappointment to allied staff Emily Nair, PA.
Make a motion to reappoint the allied staff Emily Nair.
Second.
We have a motion by Dr. Brown, a second by Dr. Hannaford to reappoint the allied staff Emily Nair, PA. Roll call vote, please.
Jasper,
Yes.
Hannaford,
Yes.
Brown,
Yes.
Paul,
Yes.
Last is to reappoint the allied staff Jennifer Nichols, NP.
Make a motion to reappoint the allied staff Jennifer Nichols MD.
Second.
We have a motion by Dr. Brown, a second by Dr. Hannaford to reappoint the allied staff Jennifer Nichols, NP. Roll call vote, please.
Hannaford,
Yes.
Brown,
Yes.
Paul,
Yes.
Jasper.
Yes.
All right, moving on to floppy. Most everything in the floppy report was of a routine nature. I will point out that we have deployed iPads to our revenue producing service areas. And to make it easier, since you haven't been here, we have focused on COVID and we have not been able to do our patient satisfaction surveys. So we are firing that back up in, for instance, urgent care, the clinics, ER, inpatient services, they all have iPads that they can hand the patients to do a quick, most of them have 5 questions. They're all the same, 5 same questions except for the inpatient. It has the food questions on it so that we can get an idea of where we need to focus our efforts to improve. Or, and actually we can, it asks if they want to recognize anybody. So we're looking forward to getting that feedback from our customers. Other than that, next was the improvement to patient care. I believe there were 8 or so contracts reviewed, archived 1, the others were compliant with no changes. Following that was the dietitian report, yes. And looking at her reports from October and November, I did email Karen a while ago and asked her to be sure and serve those. They're being served in a styrofoam container. That doesn't allow her to get a good representation of how the patients are really receiving their trays. They are serving the COVID patients in the styrofoam trays, but she would like to see a regular thermal tray like the rest of the patients receive. So made that suggestion. The dietitian report did look favorable and being compliant. I believe that concludes
We need to do the plasma.
the blood plasma, yes, the blood plasma policy. So that is just in addition to add the convalescent plasma. So basically, like Jason, who has antibodies to COVID, they take that plasma, they give it to a patient that's suffering from COVID, and that helps them fight, build antibodies to COVID to help them fight. So we added that, and we have been giving convalescent plasma to our patients, so we need approval for that.
Okay. So I would entertain a motion for the change to our blood plasma policy to add convalescent plasma.
Make a motion to add the convalescent plasma to the blood plasma policy.
Second.
I have a motion by Dr. Brown, a second by Dr. Hannaford for the approval of the addition of convalescent plasma to our blood plasma policy. Roll call vote, please.
Brown,
Yes.
Bob,
Yes.
Bassford,
Yes.
Hannaford.
Yes.
Okay.
I will say, if I may, nursing staff has done a fabulous job of stepping up to the plate and learning very quickly how to take care of these COVID patients. With the help of Dr. Rader, kudos to him. He has been so good. I don't know where he gets all of his energy and if he ever rests, but he's been really good to help us get where we need to be. Regina works her tail off. I don't know how she's doing what she's doing. She gets woke up all night long with questions and trying to find placement, for patients. And they're working really, really hard. You have no idea how hard they're working. It's tough. And I'm very proud of Share Medical Center for the level of care that we're able to offer these patients. We are right up there at the top of the care that the patients are able to get here. We're getting patients flown in here from other hospitals to take care of these patients. So it's pretty cool that, and thank you for all the equipment that we've been able to get with using the COVID funds has allowed us to do that. So we're doing a good job. It's a good thing.
Good.
That's all I got.
All right. So next is the convalescent home report. Kelly?
Well, our new motto is think positive but be negative.
T-shirt.
Yeah, you need t-shirts.
I like that.
We have, you look at I don't know how many COVID tests we've run for our 100 and some people over and over and over and over again, staff and residents. But through all that, we've only had a handful. When we were talking, we had a surveyor from the state today, and as we were going over the information she was needing, we've only had 5 staff members that were actually actively employed at the time, not on a leave of absence or something like that, who have tested positive. And we've only had 2 residents test positive, and one of those came off of their COVID quarantine Tuesday. The other one should come off later this week, early next week, depending on which guidelines they want us to follow for 10 days or 14 days or whatever it is. And I can certainly relate to anybody that has experienced frustration with the changes in guidelines as all of this pandemic has gone on. We have made quite a few changes since the last time the board met. We have knocked our capacity down to about 49 residents. We do have licensed for 80 beds, but we have 16 beds that we've taken out of commission to have as COVID positive quarantine. And then the week that we had our first positive resident test, and actually the same day, we had a wall constructed in our, temporary wall constructed in our long hall on the west wing to separate our new and readmitted residents that are also in quarantine, separate them from the COVID positives, but also separate them from the rest of our resident population. So in doing that, we added 5 rooms there to our quarantine availability, which took out 10 beds. Any resident we have in our quarantine area, they have to have a bed in the rest of the facility. So that knocks us down to 49. Our census is running around 42, 43, somewhere in there. We are still getting referrals and people wanting to come in, not that many, but it's been enough that when some people have left, that others have come in. So we're staying pretty steady with the census right around that lower 40 mark. But that's how that's going. In November, or excuse me, it was either late October or early November, we started performing our own rapid antigen tests in our facilities. We had been, up to that point, swabbing all our patients and staff, but then the tests were ringing by the lab over here at the hospital. The government is sending what they call, it's an Abbott Binex card, and it's a relatively inexpensive COVID test. Looks like a pregnancy test. I joke with them every week, wanting to know if I've got 2 pink lines or not. So it's been pretty effective for us, and we've gotten pretty efficient with it. We can test all of our staff and residents in one morning. So the staff are doing really well with that. It's been a lot of COVID. We haven't had a lot of time to focus on a lot of other things, but we do have some good things happening. We're very appreciative over there. I want the board and administration to hear this because it really touched me when I heard it. But with the COVID bonuses that are coming out, one of our aides said, this year I'm not going to have to worry about whether or not my kids are going to get Christmas. And that meant a lot to me to hear that, because I've been proud of this company for a long time, but to see that shared with being able to have all the staff feel that way about the company is pretty special. So and they do appreciate it greatly. We have had trouble with staffing though, between our staff being on quarantine for exposure reasons. Like I said, we haven't had that many test positive, but we have had staff out for having tested positive. We have not had much luck getting any more than one agency nurse aide to our facility, so our agency numbers still stay pretty low. And we might be, honestly, I don't know that. I think our staffing is such right now that I don't know that even if we did have access to more agency aides, I don't think we would need them. We're hanging in there. We have some people working a lot of hours, a lot of hours, 3 or 4 weeks worth of work in a 2-week pay period. So keep all of them, here, there, and yonder in your thoughts and prayers, because they're busting their tails.
We did offer some incentive pay because we wanted to keep our own people working. We don't want to burn them out, but we do want to reward them for those that are willing to pick up extra shifts, and that has helped.
Absolutely. Between October and November, we've wrapped up our camera project. Next week we'll have installation of our door security. Not the doors, we still don't have the doors yet, but the doors are ordered and hopefully being manufactured, and hopefully we'll see them soon. But the door security project will be next week, along with the wander management control system. We got the thermal kiosks implemented in our facility to check temperatures, and we're working on getting them all the way set up to where they do our entire screening process when staff and visitors come in. The one thing that we're picking back up is our electronic health record, and we're trying to get all the demos done with our staff so that we know which modules we're going to pick moving forward. I know when you say electronic health record in this room in particular, all you think is dollar signs, but the nursing home's not that bad. We're going to be in it for pennies on the dollar compared to what you guys spend as a hospital. So we're hoping that can move forward, because we do have some.
Make sure that it's price protected.
Yeah, price protected. Yeah, we'll make sure. They didn't increase for what we already had in place. They didn't increase any rates this year, so maybe it is price protected. But we're looking forward to getting all of that deployed out at the wings. Of course, Mark Nichols and David Selby, they spend a lot of time over at our facility running cables and wires and fibers and all that stuff, so that we would have our Wi-Fi system up to date and be able to function with an electronic health record when we did move forward. So all the infrastructure is in place. We're just ready to move forward now. And morale's good. I mean, for as hard as everybody's working, morale is still pretty good. I think there is definitely a sense of accomplishment at this point, knowing what we know about how some other facilities are faring with their pandemic, and I think the staff feel good about themselves, that they're making a difference and really accomplishing something. And when we had the surveyor in the building today, it was one of the things that she commended us for is our low number of positive cases among our staff and our residents. So that's been good. I mean, there are nursing homes out there right now where DONs and administrators are jumping ship and saying, "You guys take it," and not to mention the other staff. That we feel pretty blessed to have the crew that we have and the work that they're doing. So it's going
We're
well.
blessed to have Kelly. I will tell you, he is their biggest cheerleader. His communication, the communication over there has improved over 100%. He does a great job communicating with them and keeping their spirits lifted and patting them on the back and letting them know they're doing a good job and the things that they need to work on and keep that. I know it takes a lot of time, and he does a great job of that, so thank you, Kelly.
Thank you. I think that's all for that, but I know I've got an agenda item on there for, if you have any questions before the next item, I mean, I'd be happy to answer anything or try to.
Any questions for Kelly? If not, Kelly, if you want to go ahead.
The next item, and I don't have the language in front of me, but it's essentially for an engineering agreement with HP Engineering. The plumbing system that serves our heating and cooling system is something that we, not just the plumbing system, but also the mechanical system along with that, is something that's been in a state of constant repair or needing repair for quite some time. And we have worked with the finance committee to find an engineering firm and a proposal that we could bring to the board so that we can get an idea of what we need to do to upgrade our system and get out of this constant state of repair and into a system that's efficient and works as it should. Our system is such that when it's 80 degrees out in December, the air conditioners don't work. And so it's hot in there right now. And vice versa, if it's a cold day in the summer, the heater doesn't work because you turn one system off and turn the other system on, and that's how our building is served. And that was an efficient way to do things back in the 60s, I guess, but as far as you know, the level of comfort that our residents expect and that even our staff expect for working conditions. Not to mention the amount of money we pump into repairs and maintenance. Felt like we could move forward with seeing what we need to do to get that system replaced. The proposal that we have, or the agreement and proposal, is with the engineering firm to develop the plans that we can take to the state for approval, and then also for budgetary purposes, find out what it's going to cost to move forward to replace the system. This does not commit us into a project. This commits us for basically exploring what our options are through an engineering firm that can get us approval through the state. The price that they're asking for is under item 4 at the bottom of page 2, and they've broken it out so that we can, when we do get around to bidding out the project, we can break that down into smaller, more manageable financial projects. And the living quarters engineering is $15,000, and the rest of the building, common areas and all, is $20,000. So the total agreement is for $35,000. This will get them out here on site to look and see what we've got. Our system is not currently, there aren't any documents that blueprints or plans or whatever for our current system. So they're going to have to recreate that with this. But they'll also look and see what we've got, and then look and see what we need to do to move forward. And this is bidding a system, or engineering for a system that we've requested to be individual units in the resident rooms that operate independently of each other, and then more traditional fan units or whatever for the rest of the building. And we
By
would be,
zones, right?
yeah, by zones, and we would be going away from the chiller. The chiller tower would go out of, it wouldn't be necessary anymore with the new system. The boiler system would still be necessary because that's how we have hot water for showers and whatnot, but it wouldn't be necessary for our heating system.
Questions? So we need, before we can do anything, this isn't like us doing this at home, our own home, where we just choose who we want to go do it. And we have to have a blueprint to be able to show to the surveyors and the state of Oklahoma that we've done our due diligence to find out where everything is that we're following a plan. Am I correct, Kelly?
Yeah, make sure we meet all the long-term care codes.
Yeah.
And
Then it would allow you to go out to bid on what
Needs to be done. And so,
Wait a minute, it allows you to go out for bid after the state health department has approved the plan,
Yes.
correct?
right,
Okay.
You can't do anything until this is done.
right,
And we can't not do anything.
right.
No.
right.
Those plans he's talking about might be at the museum.
It might be.
So something needs to be
I'll
done.
call them.
You know, Steve can probably allude to this as well, just from being on the board for many years as well. We knew there was a time going to come that we were going to have to kind of ante up and take care of some stuff over at the nursing home. Well, that time has come for the heat and air. We're going to have to find the funds to be able to do it. We're going to have to come up with a plan that is budgetable. But before we can even do any of that, so we even know what type of things we're talking about, we have to have this engineering. So that's why this is on the agenda.
I will tell you, I had to, because it's important. Not only was it expressed in Finance Committee, but as in a day-to-day operation, it's also a plan that we're asking them to develop that allows us to use local licensed HVAC and electrical people to work on our system, where we won't be, with our big mechanical stuff that we have right now, we're constantly calling an outfit out of Enid or Oklahoma City or somewhere else to, have to get us on their schedule and then get out to us to take care of it. But we're asking for a system proposal that is not as, that our local folks would be able to, if they had time in their schedules, it would be projects that they would be able to tackle.
Right, and this would allow you to do it in smaller sections, not built system-wide, right?
Any other questions for Kelly? If not, I would entertain a motion.
Make a motion to authorize Kelly Parker to sign an agreement for engineering services from HP Engineering to provide mechanical and electrical drawings and construction administration for HVAC upgrades at Share Convalescent Home with a lump sum fee of $35,000.
Second.
We have a motion by Dr. Hannaford, a second by Dr. Brown for the approval and authorization of Kelly Parker to sign the agreement for engineering services from HP Engineering to provide mechanical and electrical drawings and construction administration for HVAC upgrades at the Share Convalescent Home with a lump sum fee of $35,000. Roll call vote, please.
Ball,
Yes.
Casper,
Yes.
Hannaford,
Yes.
Brown.
Yes.
All right. Kelly, thank you. Actually, Homestead?
The homestead is also having a little bit of a decline in census. It's part of that congregate living thing during COVID. If people don't have to live in close proximity to each other, they're choosing not to. They're at about 60%, 33 residents at the end of November. They have had people still moving in, and so that's a good sign. But the overall census is down from what we've been used to in years past. They have implemented over there mask requirements during activities and their social distancing and things like that. The building is actually closed to visitors at this time because the prevalence of COVID in the community is so high. We actually, it's independent living over there, and we hate to have to tell them how to do things for themselves. But we had residents over there with family members who should have been on quarantine coming out to visit, so we just locked the doors, and because we don't have enough staff over there to police it. And so we just locked the doors. The residents have the access code to be able to come and go as they please, and the people that have home health or caregivers that help them, they still have those options available to them. But for just general visitation, that's been off the table since the prevalence of COVID got so high in the community. It's been a tough adjustment for them over there, but overall it's still going all right. The staff have embraced the mask policies and whatnot when we implemented that. A lot of the residents are wearing their masks without reminders, so it's really not going too bad.
Very good. All right, any questions about the homestead? If not, Kelly, anything for the foundation?
Yes. It's that time of year where many folks are looking at their taxes and their tax situation and seeing what they need to, donations they need to make in order to put themselves in a better tax position. We have received many large gifts over the past few weeks, and we also were recipient of several in memoriam designations, either for the hospital, the nursing home, or the homestead, with folks who have passed away recently. We are anticipating a rather large bequest tomorrow, and I think I know what it is, but I'm not sure enough to announce it this evening, so I'll let you guys know later. But then also, I think there's another, and that would be for the foundation in general, but I am anticipating also another large bequest for specifically the hospital. So as those come in, I'll have those in my report for you guys in those board meetings.
All right, cool, thank you. City council report, though.
Actually, since we moved it, it's been about a week and a half, so we'll
Okay,
have it for January.
fair enough. I have a couple of items. One, for this next year, there's kind of a two-part deal here. One is, traditionally, we were meeting on the third Tuesday, and for finances and things of that nature, it would actually be best if we could meet on the fourth Tuesday. And so, you board members that are here, do we have any issue if we were to meet on the fourth Tuesday?
Does that work for you?
Me?
Does that work for you?
I work for you, yes.
If there's no issue, I would like to entertain a motion to change that to the fourth Tuesday of the month. It also allows finance to meet on the third Tuesday, and we can then have actionable items for the actual board meeting instead of we meet on that Tuesday for 3 or 4 hours and then turn right around back here in an hour for the board meeting, and those are non-actionable items. So this allows us to actually be able to take action on things that is discussed instead of waiting a month if we do that as well.
Make a motion that we change the board meeting dates to the fourth Tuesday of the month for the coming year.
Second.
Can we make that effective in January, however?
Okay.
Otherwise, you're gonna have a meeting due coming up on the fourth Tuesday of December.
True. Yeah, starting January 2021.
See, Rick, that's why you're here.
Yeah.
Yeah, one thing.
Yeah.
One deal.
You earned your pay.
There you go. Well, maybe.
Maybe. Okay. So we're going to say
But you're still
effective
seconding that, I guess.
Yes, I'm still seconding
January.
I didn't think about that.
2021.
That makes sense.
Okay, so I have a motion by Dr. Brown, a second by Kim Ball, to change the AHA board meeting dates to the fourth Tuesday of the month, effective January 2021. Roll call vote, please.
Gasper,
Yes.
Hannaford,
Yes.
Brown,
Yes.
Paul,
it. Yes.
Okay, then if you look back here to the back, there is a list of 2021. Rosemary assumed that we would approve that first one, and it's got the fourth Tuesdays for January through November, and of course, we don't meet in December normally. This year, you did get one, because I'm needing to move it. So we need to entertain a motion to approve those meeting dates for 2021.
Make a motion to approve the 2021 Alva Hospital Authority Board meeting calendar.
I have a motion by Dr. Hannaford, a second by Dr. Brown, for the approval of the 2021 AHA board meeting calendar. Roll call vote, please.
Hannaford,
Yes.
Brown,
Yes.
Paul,
Yes.
Gasper.
Yes. All right, there were no items of new business. I just do have a closing remark. When this COVID deal started, we didn't see any immediate effects upon, at least here at the hospital. I know things immediately probably changed over at the nursing home and changes that need to be made. And there were some changes, but we weren't as taxed as what has been over the last 60, 90 days. And I think I speak on behalf of the whole board when I say thank you. And that thank you, I don't know if we could shout it from the rooftops to be able to tell every single employee, and I don't care what your role is at the hospital or the nursing home or the homestead, but thank you. The work that you guys are doing is taxing. It probably goes thankless many days from many people, but the work that you're doing is changing lives, saving lives, and you're making a difference in this world that we live in. And so we say thank you to you guys, Candace and Steve, Chris, Kelly, everybody. I know that there's been extra meetings. I know that there's been extra hours, and that is taxing upon you guys to get everybody where they need to be and get what we need and all of that. thank you. And I hope that the extra incentive, I hope that the some of that back bonus pay, whatever we want to call it, I hope that does make a difference. As small as token appreciation that it may seem, it was a big deal for us to be able to do it. That's not something that we've ever really been able to do. And so I hope that everybody can understand that we are appreciative. No, we're not there every day, but we hear stories. We hear stories of people that have been here, that have been served, and are appreciative that we have this hospital, that we have this whole medical center. People, just today, I'm riding with some people, and they hear other medical facilities and the number of employees and patients that are having COVID outbreaks, and why are we not hearing that from Share Medical Center? That's a testament to you guys. That's a testament to the work that you're doing, the precautions that you're taking, and so good job, and thank you, and keep up the good work, and Merry Christmas.
Merry Christmas.
We're adjourned.